All right, so in this video, we're going to talk about biases and the othering of groups of people in healthcare. As someone who currently works in healthcare as a medical assistant for a urology practice, I get to experience some of these biases pretty frequently. And the one group of people that I want to identify as being a group of people that is othered would be the overweight individuals. And usually, the common biases that I see are that individuals that are overweight or obese are like lazy and have poor life decisions and will not follow to any advice. So that's one of the common biases that I see, and I witness this on a daily, day-to-day basis. I also see a lot of biases about smokers having the same bias towards them, in which these people understand, these individuals understand the health risks of either having a poor diet such as the overweight class or having a smoking habit, um, and so they won't listen to any healthcare advice. So these physicians have these biases that whenever they come in contact with these patients. And when we look at the Cross Carry article, I thought it was a really good article. It talked a lot about the the cognitive debiasing, and essentially how the principal factors behind diagnostic errors come from biases. And so when we look at the type 1 and type 2 types of cognitive, these type 2 biases, we see that type 1 is the intuitive phase type of bias, and then we try to balance it with the type 2. So once we get that balance, we could limit those diagnostic errors. And the Cross Carry article mentions the four different types of cognitive processes: the hardwired, the emotional, the overlearned, and the implicitly learned processes. And one of the common ones that I see are these overlearned processes, where sometimes physicians will see, as mentioned in the article, the quote unquote frequent flyers. So if we have a patient that keeps coming back with the same issue, um, they tend to develop this bias, like that the patient's not listening, and they get to see this patient frequently. So right away, when they see that the patient's name is on the list, uh, that kind of intuitive bias kicks in. And so they, have this frequent flyer response. Why is this patient coming back? And keep mentioning it. Um, do I think that this group of people experience the same care? So if we compare the care that the overweight class faces versus, um, someone that's not overweight, I think the care is much more different. For example, the availability of equipment can vary. Some hospitals don't have the right equipment for those patients. Even in our office, we sometimes get to see overweight individuals and we can't help for them because we don't have equipment such as a Hoyer lift, or even just machines for imaging. There's a lot of limits to what could be done. So yeah, these overweight individuals do face a ton of challenges in healthcare besides just the bias that they may face when coming in for healthcare. And so this kind of plays a big effect on this group of people, because you're seeking care and being, the one place that you try to go get care, and they lack the equipment that's needed. Um, so it really hinders nurses' ability to care if they don't have the right equipment. It makes the patient go to various locations because one location might have something that the other doesn't, so they have to go to that location. It causes a bigger stress on them. Availability of transport. It's a whole combination that affects them. Um, and if you could change the healthcare system to better meet the needs of this population, I think all starts with education. I think the first step would be to incorporate more teaching about this group of individuals, whether it's smokers or overweight. The focus of this video is the overweight class, but it could work for any group of individuals. I think it all starts with education. Um, there has to be some education about the terminology that we could use when talking to somebody. We want to provide some good education related to their health, but we also want to learn respectful terms when talking to somebody about their weight, because it is a fairly sensitive topic. Some people are more open to talking about it, some are not. Some become offended. So I think it's learning how to communicate with this group of people, and just learning about the resources that places need to help provide a greater care for this group of people, whether it is taking a look at what's most often missing, what equipment is more needed for this group. Do we need more Hoyer lifts? Do we need an easier accessibility for this group of people? So it all, in my opinion, it all starts with educating and learning the right respectful terminology to help address the group, and maybe talking to providers and having them complete a course too about these types of biases that we have, such as what we're learning.